You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Building Sustainable Healthcare Homes is a new podcast series showcasing AAPCHO's Cultivating Traditions of Wellness 2010 Conference and Gala on February 23, 2010 in Washington, D.C.
In this episode, Kanani Kaeo, Team Office Manager for Waiola Clinic, one of the satellite family practice clinics for Waianae Coast Comprehensive Community Health Center, shares how Waianae's Graduated Competencies program fostered her personal and professional growth.
Hi, everybody, and aloha. My name is Janice Kaeo, but please call me Kanani. First of all, I thank God for bringing me and all of you here safely, and for giving me this wonderful opportunity today. Let me take you to the beginning. In 1986, a year after my graduation, I visited Waianae Comprehensive. While growing up, we really didn't go to the doctors. My mom took care of us. So the only time I ever remember going to doctors was for a physical. I went there with my cousins, and while in the emergency room waiting for her and her family, somebody recognized me and they told me, "Hey, you Jeremiah?" "Yeah." "What you doing now?" "You working?" "No." "You like work?" "Okay. Turn in an application tomorrow." And I did just that. I turned it in the very next day and decided to be a volunteer. The day after I volunteered, I was hired. Back then, I didn't realize that it was the very beginning of my workforce career. And after many requests, I finally got a full-time permanent position. It increased my determination and desire to learn anything and everything about my job. It was a privilege to work with and meet so many great people who made a difference in my life. They just shared their knowledge, life experiences, correction, and advice, which helped me to grow personally and professionally. I am currently the Team Office Manager for Waiola Clinic, which is one of the 4 satellite clinics. I'm responsible for the clinic's daily function and operations, quality patient care and satisfaction, provide and support staff coverage and QI measures, monthly team meetings and budget, just to name a few. I participated and completed GCP, Graduated Competency Program, our workforce development program at the Health Center that was funded by the Robert Woods Foundation. It included courses offered through Leeward Community College and other courses developed by the Health Center staff, electronic medical records, corporate compliance, business finance, quality improvement, and information technology. After completing the program, I received a certificate of completion for business technology. It was an honor for me and many others because it was we were the first of our families to receive any college certificate. It may not be a degree, but it was a certificate. We was proud of ourselves. Now with added skills and confidence, I am interested in continuing my education and working towards being enrolled into a licensed practical nursing program. In the meantime, my supervisor selected me to be a receptionist educator. In this role, I am responsible to prepare curricula and testing for clinic receptionists at a minimum of 5 core competencies each year. During the biweekly sessions, interaction and group participation is encouraged. I've learned that the best way to communicate and work with support staff is to listen to their questions, concerns, and suggestions. The important thing is to follow up and resolve any unanswered questions. For me, the Health Center has always been an ohana environment. Our patients, providers, staff, and their family becomes a part of my life. I cannot take all the credit for my accomplishments when there are so many individuals who made a positive impact in my life. I, as an individual, I can't do it by myself because I'll find myself working harder and taking longer to reach my goal. But when we can come together as one, as a team, and work together, we can get things done efficiently and effectively. Thank you.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org.